So far we put it in emergency room settings, and actual space for the person to do it has been the first barrier.
It actually has been working okay. When they brought on students and then hired people to come help us, that helped a lot, because as much as we would love to have our behavioral health social workers run up here all the time, it really doesn't work well for them or for us, and it just doesn't work well. You can't everybody do their job and timely flow that when we only have a few rooms per provider. If you had extra rooms that were dedicated to the behavioral health staff and that patient to go to that room while they're doing that, that would give us our room back. That's probably been the major problem.
My boss was very good at being that person that went in and explained. He advocated, real estate in an emergency department is fairly precious, and he went in and got us space and got us materials and things.
The biggest barrier there is trying to work it into the actual workflow, right?
Well, anytime that you take time away from getting patient to provider, that affects your daily flow and your response time and those kind of things. However, given the scenario, how we have it set up now, I think it just flows along with it. So it's just another step, like if you were going to triage a patient, or there's certain things that has to happen before you get a patient, and that's kind of incorporated into it now.
The second barrier is, well, who's going to pay for this, right?
There'll be a lot of people that might test positive on their pre-screens or their full screens, and then they have an issue with, well, I don't know if my insurance covers being able to see Tom or see the specialist to work on my depression issues. And so some might not have insurance, some might be underinsured, some just might have questions that they don't know how to actually ask their insurance provider, that I can kind of just go in there and be kind of the third person to do. So that's kind of nice to be able to tell somebody, yeah, you actually can get these services and they're not going to be a cost, or how can we work this so it meets your budget but yet also meets your behavioral health need.
For us, this is not a short-term project that we're doing to get some grant money and then we're just going to go back to business as usual. We're going to continue to, keep the system in place because of the value of it and the way it helps us to, operate our practice here.
The third barrier is, how are the patients going to feel about that?
It's a change. The patients aren't too bad. Some of them were really mean for a while about the papers, and we're just like, well, don't take it personally, we do it to everybody. And usually if I talk to them for just a little bit and say, well, you can't say that substance abuse, mental health, depression is not a big thing. You turn on the news and you can easily find where somebody has killed themselves, overdosed, went in and shot up a bunch of people, and can't say it's not a problem, so we're all focusing on it. And I said, maybe you don't have a problem, but somebody does out there, and by bringing it up, they're more likely to say something.
It depends on the patient. Most view it as just, additional information, just along with the other questions. It kind of feels like it goes right along with that. Some have been a little bit resistant, especially when things are a bit more personal. They don't really understand how it applies, and I try to explain, this is new, this is research that we have to do so we can continue to do this. But for the most part, people seem to accept that it's just part of the process.
But when it gets down to the nitty-gritty and you have to ask people if they're having suicidal ideation or homicidal ideation, that kind of makes it a little uncomfortable. As far as, do you have any medical problems as a result of your drug use? Have you ever harmed anybody because of your alcohol use? So those were the tough parts for me. The rest of it was pretty easy.
I have had patients where it was just them, and I was asking them these questions, and they're like, why do you need to know that? And so I kind of, just revert to the fact of, remember, this is, research data collection, and we're trying to, understand, different scenarios. I go, and all you're doing is you're just helping us figure those scenarios out. And then they seem to work out and are fine with it.
You have to ask about sexuality or questions like that. They're a little resistant, but I just let them know, it's for demographic reasons. They don't have to answer them if they don't want to. They're allowed to refuse. So that makes it easy when you can tell them that they don't have to, but it's just for data collection purposes. They're okay with that.
I've had a lot of kind of, not upset looks, but just confused, like, why is this, why are you asking me these questions? And basically, I tell them it's part of your overall health care, It's important to know how you're doing in these areas for your overall health.
The fourth barrier is, well, what resources do we have if we ask people about depression and alcohol use? How are we going to actually deal with that?
Maybe resources would be one challenge, because I think that we're in such a small community that resources are kind of few and far between, and we kind of use the same ones because there's only a handful of them. But the great thing about that is that the resources that we do use, they have been very open to us, and because I'm the one calling for those resources, and so they've been very kind and generous to our patients and understanding what kind of our role is. So they have worked really well with us, which is a really good thing. But the lack of, there's only a certain amount of resources that are available in our community, so I think that that's probably would be the only negative I can think of. But we push through it, and I think our community has been really open to it, so that's been a real blessing. So.
Well, we have a lot of different agencies that we partner with as far as providing services, and because I don't do, for instance, drug and alcohol treatment or assessment, we've invited agencies who do offer those services to come in and give us some information about our services so that all the staff is aware of the services that are available in the community. And for some situations, it's more appropriate for people to go elsewhere for counseling services as well, even though we do offer that in-house. It depends on the individual's needs, where they live, what they're looking for, the type of treatment that they want. And so we want to make sure that we're giving them what they need so that they can best benefit from those services.